Good day, everyone. Today we will present our research title, Lung Cancer Severity Prediction Using Classification Algorithms. This study focuses on how classification algorithms can assist in predicting lung cancer severity levels using clinical and symptom-based data, with the goal of supporting earlier and more accurate clinical decision-making. Lung cancer is one of the leading causes of cancer-related deaths worldwide. One of the main reasons for this high mortality rate is delayed diagnosis. In many cases, early-stage lung cancer shows only mild and non-specific symptoms, such as a fatigue or shortness of breath, which are often ignored and misinterpreted. Traditional screening methods, such as low-dose CT scan, are effective, but they are expensive, require specialized equipment, and are not always accessible, especially in developing regions. As a result, many patients are diagnosed only when the disease has progressed to more severe stage, significantly reducing survival rates. Given this limitation, there is strong need for data-driven and cost-effective approaches that can help identify high-risk patients earlier. Machine learning provides an opportunity to analyze complex patterns within clinical and lifestyle data that may not be obvious through conventional statistical analysis. This research explores how machine learning models can be used to predict lung cancer severity levels and support early risk stratification. For our objective, uh, to compare a traditional machine learning model, basic regression, with a deep learning approaches, especially 1D CNN, for lung cancer severity prediction, to evaluate model performance using standardized classification metrics, and to analyze a trade-off between accuracy, interpretability, and robustness, particularly in a clinical context. Next, for our dataset. The dataset used in this study was obtained from a public source, especially Kaggle. It consists of structured clinical data that includes patient demographics, such as age and gender, lifestyle and environmental factors such as smoking status, passive smoking, alcohol use, and dust allergy, and clinical symptoms, including wheezing, chronic cough, chest pain, fatigue, and shortness of breath. The target variable label level represent our lung cancer severity and is categorized into three classes: low, medium, and high. This dataset is suitable to classification tests and reflects real-world clinical scenarios where multiple risk factors are stimulationless.
Okay. The research methodology follows a structured machine learning pipeline. First, the dataset was pre-processed. These include removing irrelevant identifier columns, handling missing values, encoding categorical variables into numerical forms, and normalizing features to ensure a stable model training. Next, the feature selections was performed using two statistical approaches. First, a multinomial p-value analysis, and second, a chi-square test. So this both is used to identify the most informative features related to lung cancer severity. Then the data was split into training validation testing using a 70-15-15 ratio. Two models were developed. First, logistic regressions, which serve as a baseline model. It is widely used in medical applications due to its simplicity and interpretability, modeling the log odds of severity levels as a linear combinations of input features. The second, a 1D convolutional neural network adapted for tabular data by treating the feature factor as one-dimensional signals. This allows the models to capture nonlinear interactions between neighboring clinical features that traditional model may miss. So the model evaluations was conducted using metrics such as accuracy, precision, recall, F1 score, and AUC, along with confusion matrices and learning curves. And the experimental results shows that both models performed well in predicting lung cancer severity. Logistic regressions achieve a strong baseline performance with accuracy reaching approximately 90.5% in one experimental setup. This confirms that traditional model remains effective when feature distributions are well separated. However, the 1D CNN consistently outperformed the logistic regression, achieving accuracy levels up to 95%. The CNN also demonstrated the greater robustness across different feature selection strategies. Confusion matrices indicate fewer misclassification, particularly between medium and high severity cases. Training validation curves show stable convergence and no significant overfitting, suggesting that the CNN generalizes well despite the relatively structured nature of the data. These results indicate that while logistic regression is reliable and highly interpretable, it is limited in modeling complex nonlinear relationships among clinical features. In contrast, the 1D CNN is better at capturing subtle interactions between symptoms and risk factors, leading to improved classifications performance. From a clinical perspective, this highlights an important trade-off. The first, logistic regressions offer transparency and ease of explanations, while CNN-based models offer high accuracy and robustness, which is critical in borderline or ambiguous cases. In conclusion, this study demonstrates that machine learning models can effectively predict lung cancer severity using structured, clinical, and symptom-based data. While logistic regressions remains a strong and interpretable baseline, the 1D convolutional neural network shows superior performance and robustness by capturing nonlinear feature interactions. These findings suggest that deep learning-based approaches have strong potential for integrations into clinical decision support systems, helping clinicians prioritize high-risk patients and improve early detection. Ultimately, such systems may contribute to better prognosis and reduce mortality from lung cancer. That's it for our presentations. Thank you for your attention.